Antibiotics, the modern wonder drug. Brought to you by Fuzzo, the makers of the best-selling asbestos-lined fireproof child's pajamas for 40 years. Fuzzo, since 1915.
What's the matter, Susie?
I don't feel good. I don't know what's wrong.
Well, as your healthcare professional, I can tell you that you need an antibiotic.
What's an antibiotic?
Well, I'll explain it to you in a way that even your feeble girl brain can understand. Alright, Susie. Think of a bacterial infection as the communist menace trying to invade your body. Antibiotics are like our United States military. And antibiotics are our frontline defense. First class of antibiotics affect the cell wall of bacteria. Penicillins have beta-lactam, which destroys the cell wall of bacteria, making them susceptible to death. Some other types of cell wall inhibitors are semisynthetic penicillins. These are broad spectrum and infect more bacteria than just natural penicillin. Another type are the cephalosporins. Cephalosporins are also broad spectrum, and they resemble and work pretty much the same way as regular penicillins. The last type are the antimycobacterial antibiotics. And these affect the mycolic acid in tuberculosis. The next class of antibiotic affect the protein synthesis of the bacteria. Protein is used by the bacteria to facilitate communication between the messenger RNA and the transfer RNA. Some types of these are the aminoglycosides. Aminoglycosides were the first antibiotics to have activity against gram-negative bacteria. Another type are the tetracyclines. Tetracyclines can penetrate body tissues well and are especially valuable against intracellular rickettsia and chlamydia.
I get the clap.
And finally, the macrolides are a frequent penicillin substitute for the treatment of streptococcal and staphylococcal infection in children. The next class of antibiotics are the nucleic acid synthesis inhibitors. These work by selectively inhibiting an enzyme needed for replication of DNA. These antibiotics are the drug of choice for UTIs and certain types of pneumonia. Our last group of antibiotics are the competitive inhibitors of the synthesis of essential metabolites. They work by getting to the receptors that the bacteria wants to use first, rendering them unable to use them. Modern antibiotics have diminished the importance of sulfa drugs in chemotherapy, but they still have specialized uses, and combination drugs like sulfadiazine, used to control infections in burn patients. Sometimes bacteria can become resistant to antibiotics. During the overuse of antibiotics can cause resistance. Make sure you always finish your course of antibiotics so that the strong ones don't survive to wreak havoc another day. To combat these resistant bacteria, we have to create stronger and stronger drugs to fight them off. And that, little Susie, is how antibiotics keep the red menace from invading you. And you.
I want to be a doctor just like you when I get bigger.
Don't be silly, you're a girl.